Welcome to On the Beat, everyone. I'm Troy Thompson, and today we're talking all about esophageal cancer with Dr. Ricky Johnston of Gastroenterology Associates of Columbus. Welcome to the show, my friend. Nice to see you again.
Thank you. Same to you.
All right, can we start with what is esophageal cancer? Where is it in the body, and where did it start from, if we can? Dumb it down.
Okay, so the esophagus, which is our GI tract, starts at the mouth, ends at the exit, the anus,
yes,
and you have the esophagus, stomach, and intestines in between. So the esophagus helps propel the food from your mouth down to your stomach.
Got you.
So cancer of the esophagus is just that, would be cancer that affects the esophagus. Because you can have cancer that affects any organ in the GI tract, stomach,
really?
Yeah. Colon cancer, which we spend a lot of time focusing on, but esophageal cancer, while not as common as some of the other ones, is something that we do see.
Okay, before we get into the symptoms and things like that, one thing I always ask when about cancer, okay, is it more prevalent, this particular cancer, in the African American community? Is it in the white Latino community? To begin with, let me answer that one.
So that's a great question I wanted to touch on, so I'm glad you brought it up. There's actually two subtypes of esophageal cancer that we deal with.
Okay.
One is called squamous cell carcinoma, and this is just kind of to the specific cell types that it affects. So squamous cell carcinoma, which affects more of the mid-esophagus, and then there's what's called adenocarcinoma, which affects the lower esophagus, just down where the stomach and the esophagus join. So the squamous cell, the one that affects the mid-esophagus, the risk factors for that are alcohol, tobacco, and black. Black men have a much higher risk of that.
Interesting.
Yeah. And so adenocarcinoma, the one that affects down where the stomach and the esophagus meet, at the lower end of the esophagus, is more in white men, particularly those who are over 50, obese, and have a history of acid reflux.
Okay, all right. Now, is this hereditary? Because we know a lot of cancers can be, if you may have that gene.
Yes, certainly there are a lot of cancers that are more hereditary. I'm not, there may be some genetics at play with this one. I'm not sure that it's quite as impactful as it is on other.
Okay, is there a test to know if I have that gene?
Not that I'm aware of.
Okay, got you. All right, what are some of the symptoms that we may have esophageal cancer?
So the biggest one we see is just trouble swallowing.
Okay.
And so we talk about that. I think we've had some topics on that in the past, but difficulty swallowing, meaning that after you swallow, particularly solid foods, it seems to get hung up or stuck as it's going down the esophagus. And that can, people will describe it anywhere from the xiphoid down here at the bottom of the sternum all the way up to the sternal notch. And it can feel like it's sticking anywhere in between. So
like it's clumped there.
Yeah,
it's like a blockage.
Like you swallow and it feels like it sticks and won't go down. And you have to drink water or something to kind of push it down. Now, there's different reasons people can have trouble swallowing. Esophageal cancer tends to be more of a consistent and then progresses over time. So eventually people may get to the point where it gets so tight that all they can get down is liquids.
Right, okay. Okay, so one of the side issues with this, would that be dramatic weight loss?
Oh yeah,
if you're at that level?
Yeah.
Okay, what are some of the risk factors of this?
So for
weight loss? The signs of the cancer.
So, signs of the cancer. So weight loss, trouble swallowing, vomiting, bleeding, anemia. Those are some.
Is that something that we go to our local GP about first, and then they send them to you for tests?
It varies. Some people will go see their local practitioner or primary care provider just because they're having trouble swallowing or they're losing weight. Some of them will go ahead and make a referral directly to us. Sometimes they end up with the ear, nose, and throat doctors because it's a swallowing issue, and so we actually get a lot of referrals from them as well. One
question. Treatment, I know it's cancer, so it's probably radio and chemo and things like that, right?
Yeah, and so that's kind of outside of our expertise, but there are some treatment options for it that it can respond readily to, specifically the squamous cell that affects black men mostly. It has a pretty good response. Now, really the biggest thing is prevention. We can actually prevent,
really?
And that's treating acid reflux. There's a condition called Barrett's esophagus, which is a precancerous condition that affects the lower part of the esophagus, and that's the precursor to the adenocarcinoma. So if we know that Barrett's is there's things that can be done to deal with that in the early stages to prevent it from becoming cancer.
Dan, you give us good information. Thank you. We really appreciate it. Very diverse. I love it. If you want to find out more information, there it all is up on the screen for you. These doctors, guys, are the best. You know I've been to see them for treatment as well. We'll be back after this short break.